Hi, everybody. This is Dr. Ramsey Asfour, infectious disease specialist from Capsid Consulting with Dr. Dost Sarpel and our superstar infection prevention nurse, Marianne Caruso. We wanted to just talk a little bit about the highlights of 2023 as this year comes to a close. And let me start by asking Dr. Sarpel, what do you think are a couple of the issues that we faced in 2023 from an infection prevention standpoint, and how do you think things have changed since coming out of the super pandemic mode of COVID-19?
Uh, sure. So some of the challenges that we've been facing are increase in antibiotic-resistant organisms, mainly driven by the COVID-19 pandemic. CDC released a report saying that there was an increase in these organisms such as Candida auris, which has been the biggest one to date and has spread throughout the country, as well as other carbapenem-resistant organisms. So we lost ground there during the pandemic. There was a more recent report that said we may be making up some of that ground, but we still have a long way to go. And I think that is sort of the biggest thing in infection control for 2023 is these resistant organisms and trying to prevent the spread of these organisms, which is through PPE, good hand hygiene, good infection control practices, antibiotic stewardship, all these things that we need to be aware of.
Marianne, do you want to add to that, or what do you think were the biggest challenges?
I think I really enjoyed watching the process as our facilities that we assist gained confidence, learned new skills. The patients coming into long-term care now and assisted living are just getting sicker and sicker. The level of care has changed dramatically. And to juggle that while at the same time you're juggling an actual pandemic, plus all the other infectious diseases that are always a threat in the long-term care setting with those vulnerable residents, watching infection prevention and control practitioners gain confidence, learn new skills, put those into motion, and build relationships with the hospitals that they work with, acute care setting, to help keep the programs running, such as stewardship and monitoring antibiotic use for, say, UTIs, decreasing that use or shortening courses. And we're seeing those things begin to improve across the board and those partnerships build. And I think that's a good trend. And I really enjoyed seeing that happen.
Great, great. I agree. I think that it's been a good trend. I think we're seeing a lot of the facilities that we've been working with really stepping it up a notch, right? That with their experience through COVID and now the realization that a robust infection prevention plan is super important. I think a lot of facilities are really realizing that they can do better, and our partnership with them has really helped prevent a lot of issues and that they might have had otherwise. And I think the facilities that have had recent surveys have really come out ahead compared to where they had been prior to Capsid working with them. So, well, I think we all look forward to what 2024 is going to bring, and we have a lot of experience that we're going to keep building on. And please stay tuned to this channel for further updates from Capsid Consulting. Thank you, everybody.